So the first thing about endoscopy and colonoscopy is to get the terminology correct. We quite often say endoscopy or upper GI endoscopy when we're talking about a camera test that goes through the mouth, down into the food pipe and stomach. And that test is often arranged because someone's got a problem such as heartburn or reflux that's kind of causing some issues at the top of the abdomen, bottom of the chest, or sometimes because they have pain a bit lower down at the top of the abdomen. And so that's when you might do an endoscopy. A colonoscopy is usually arranged to investigate problems relating to the other end of the gastrointestinal tract. So often people have diarrhea or bleeding, or may have bloating and abdominal pain that can be attributed to the colon. And for that, you need a camera to go through the bottom end up into the colon, and we see just the end of the small bowel with a colonoscopy as well. So that's some of the indications for those endoscopic investigations. So the first thing to say about getting the preparation right for either an upper GI endoscopy or a colonoscopy is it will be discussed with you and explained to you by the doctor proposing the procedures, and then often by an endoscopy nurse who will help schedule the procedure at a time that suits you. It's really important that these preparations are done correctly because it gives the test the best chance of achieving the diagnostic intent, finding out what the problem is, doing whatever's necessary, which may be taking biopsies or taking off polyps that are small growths that can occur in the gastrointestinal tract. And so, broadly speaking, to prepare for an upper GI endoscopy, it's important not to eat and drink for a period of time before the procedure. Often 6 hours is enough. But these may vary from place to place. And for a colonoscopy, it's often necessary to take an oral bowel preparation medication, which is like a really strong laxative that clears the bowel out. And you tend to do that the day before and the morning of the procedure. Again, the exact timing will depend on the timing of your procedure when you take those bowel preparation medications. There's also a diet that you may be asked to go on to a day or two, or perhaps 3 before the procedure, whereby you don't eat much roughage or fibre and stick to a low fibre diet during that period of time. So it's really important to get right, but it will be explained to you really clearly by the team that's proposing the procedures. So we totally understand that people coming for endoscopic procedures are often anxious and nervous, and it's almost universal that people are slightly worried about the procedure they're about to undertake, unless they've done it lots of times before, in which case they tend to be a bit more relaxed. So we try and make you feel as at ease as possible. We're of course professionals who do these procedures every day, and we try to make you feel at ease. We understand that you're often hungry or feel slightly thirsty because you've had to be nil by mouth for a period of time, or you might feel dehydrated because you've had to have the oral bowel preparation medication, or you might feel slightly tired because it's interrupted your night's sleep the night before a colonoscopy, for example. But what you should expect when you come to the hospital is that you'll go through a pre-admission check with an endoscopy nurse who will make sure everything's in order for the procedure to go ahead. And then you'll meet with the endoscopist who's going to do your procedures, and they'll go over the consent form with you. And the consent form is really important. It means that you have the chance to ask any questions you have about the procedure. It means that the endoscopist explains the procedure in detail and what may be undertaken as part of the procedure, for example, biopsies, where they take a sample of tissue, or to take away a polypectomy, which is a small growth in the bowel, and we tend to take those away because they can be problematic if left in place. And so they'll explain to you the pros and cons, the risks and benefits of the procedures. And like I said, you'll have the chance to ask any questions based on those discussions. And then once you're happy and the endoscopist is happy to proceed, they'll ask you to sign the consent form. And from there, a small cannula would be put into your hand. That's a little needle that goes into one of the veins if you're going to have intravenous sedation, which quite a few people do have. And some medication will be given into that to make you nice and relaxed and sleepy. You may not fall completely asleep unless you're having a deep sedation procedure, in which case you would expect to be completely asleep. And once the procedure is done, it doesn't tend to take very long, but once the procedure is done, your recovery is really quite quick. You'll be kind of feeling back to normal and kind of awake within half an hour, and then you should be able to go home later on that day and kind of eat and drink normally, which people often look forward to because they're hungry and thirsty by the time the procedure is finished. And the recommendation is, if you have had intravenous sedation, that you should have someone to pick you up from the hospital. That's really important because you may feel a little bit unsteady on your feet, and that person should stay with you for that evening and really until the next morning. You should have someone with you. By the next day, you should feel kind of back to normal really, and should be able to go about your daily activities and work. The only other thing that most departments will explain is that it really isn't a good idea to drink alcohol on the night of the procedure if you've had intravenous sedation, so it's probably best to bear that in mind too. So there are risks of both endoscopy and colonoscopy, but it's really important to say that these procedures are done up and down the country multiple times each day and are considered very safe medical tests, especially the upper GI endoscopy. It really is very rare to have any problems at all related to the upper GI endoscopy. It's a safe and relatively quick procedure. Colonoscopy is associated with a couple of risks, but they're rare too, and there's lots of things that your endoscopist will do to avoid any complications. The complications that they will talk to you about during the consenting process fall into two categories really. The first is bleeding that can occur as part of the procedure. That's more common if we need to take away polyps, growths in the bowel, and especially if they're large growths. And damage to the lining of the bowel as part of the procedure is the other complication that can arise. And again, there are lots of things that can be done to avoid those complications, but they are things that you should be aware of and should be made aware of during the consenting process. Most endoscopists will consent for a risk of 1 in a couple of thousand for risks like those, complications like those. So in terms of the immediate recovery, if you've had what we call conscious sedation, which means you're kind of sleepy and a bit relaxed, but not fully asleep, once you get back to the recovery room, you'll start to feel back to your normal self really quite quickly, and you'll want to kind of, have something to eat and drink probably within the next half an hour, and want to get up and about, kind of get changed and get ready to go home. It really doesn't take that long for most people. An hour would be a conservative estimate, and once you have someone to take you home after this, if you've had sedation, like I said, that evening you may feel a little bit sluggish and not quite yourself because you had a procedure and sedation that day. By the next morning, you should start to feel back to normal. And I think most people would go about their normal activities, so go to work and things the day after. So it really isn't that much of a recovery period for most people in most cases. If you've had no sedation, then often the recovery period is by the time you come back to the recovery room, you'll feel well enough to go home. And if you haven't had sedation given intravenously into the veins, then you can leave the hospital on your own. You don't necessarily need anyone to accompany you if you haven't had intravenous sedation.